Yeah, just push it. All right. Right up here, they show the veins above the heart real well. The blue ones, right? The blue ones. All right. These are internal jugulars, there and there. Those are internal jugular veins. These are external jugular veins. So these are the internal jugular veins. Those are the external jugular veins. For some reason, the subclavians are split, but that's a subclavian. And then they join, that little bit right there and right there are branchiocephalic veins. There's not very much, though. So that's your internal jugular, external jugular, subclavian. That little bit right there and right there is what? Branchiocephalic. Then they merge to form the superior vena cava. So from right here, from basically right here to here is the superior what?
Vena cava.
Vena cava. This is your inferior what? Vena cava. All right? Those are carotid arteries, right? Carotid arteries. See them? They're red. Okay? So these are internal jugulars, external jugulars, subclavian, innominate, basically from right there to right there. That's your superior, don't worry about that vein. That's your superior vena cava. This is your inferior what? Vena cava, right? That's your inferior vena cava.
And where are the carotid ones?
Right here, these red ones right there.
Oh.
See them? All right, that right there is the larynx, and this is the trachea. That's the larynx, and that's the what? Trachea. So that's, and of course, other stuff on this slide. That's a heart, obviously. Lungs, what are these? Liver, right? Liver. That's about all you can see.
Can you
So
see diaphragm?
larynx, esophagus, heart, lungs, liver,
What about diaphragm?
internal jugular, external jugular, subclavians, branchiocephalic, superior vena cava, inferior vena cava. Diaphragm is cut away right there. You can see a little bit of it.
Is trachea and esophagus the same thing?
No,
Is behind us.
esophagus is behind the trachea. Okay.
Next.
All right, this is showing some of the arteries around the heart. Okay. This is your right ventricle. This is your pulmonary trunk coming out right there. That's your pulmonary trunk. Coming out under it is aorta, and that's your aortic arch. Pulmonary trunk, aortic arch. The first artery to come off the aortic arch is your branchiocephalic artery, right there. From right there. That's only on the right side. You have right and left branchiocephalic veins, you only have a right branchiocephalic what? Artery, right? So that's your branchiocephalic artery right there. Then that becomes a subclavian. This becomes the carotid that comes up. One of the carotids that comes up. The other carotid's over here. And that's your other subclavian. All right? But, so, this is your pulmonary trunk, right? Coming out of the right ventricle, pulmonary trunk. This is your aorta, the arch of the aorta. Then that's your what? What, from here to here? From here to here, branchiocephalic artery. And yeah, actually the carotid on the other thing was better, right? But you can see the carotid, the common carotid, the external and internal. And then this is your what? Subclavian artery right there. Subclavian artery. And again, there's livers, and there's pancreas, and there's what? Diaphragm. I don't think it shows this up here doesn't show the esophagus and trachea as good as the other picture. Okay? This shows a little bit. This isn't real good for much of anything. The lungs and the heart, that's basic. Go to the next one. All right. Here's a good one. Lungs, heart, diaphragm, liver, right?
Spleen.
You see your inferior vena cava coming up. All right. Kidneys. These are the kidneys. These are the ureters. See? Kidneys, ureters. Kidneys, ureters. They're emptying into what? The bladder, right? The bladder. The bladder. All right? The bladder. And actually it's kind of hard to see, but the urethra would go down like that. The urethra would go down go down like, well, yeah. Actually, yeah, because it comes down like this. It comes out up here. All right?
Mr. Robinson?
Yes.
Okay.
All right, so there's your kidneys, your ureters, urinary bladder, right? That's all right. Now this here, the urethra comes down here. This is right here, though. This part of it right here, this is the penis. This is the penis, preputial orifice. These are testes. There's one over there in the scrotum still. That's obviously a male pig. Okay? Let's go over it again. Liver, lungs, diaphragm, of course. Kidneys.
Is that
Kidneys.
a spleen on the right of the liver?
Well, it might be, but
Right
there's a
above the
better
kidney?
view of it. I got a better view of it here in a minute.
Oh, okay.
These are the ureters. There's your bladder. Part of this is urethra, but most of this in here is the penis. Penis, preputial orifice, and those are what? Testes, right? Testes. All right, go to the next one. All right. Okay. Heart, lungs, there's your spleen. There's your liver, there's your stomach, it's kind of collapsed. This is your pancreas right here. That's your pancreas. That's your pancreas. Small intestines, colon or spiral colon and large intestines. I'll accept all of that, right? I'll accept all of that. All right, now, this is a female pig. The ovaries are there. There's one ovary, the other one's over there. It doesn't show up real well. These are fallopian. These are fallopian tubes or uterine tubes. You can use either term. I'm not going to designate where one stops and the other begins, okay? So that's your ovaries, fallopian tube. They merge to form the uterus. From right here, that's your uterus. And then this here is the vagina. This is the what? This is the bladder, and this is the what? Urethra, right? The urethra. Okay? So let's go over these again. Heart, liver, spleen. No, how would I say that? Heart, lungs, liver, spleen. Stomach, pancreas, small intestine, spiral intestines, or colon, right? And then down here, ovary. There may be one over there. I can't see it in this view. There's the fallopian tube. They merge from here to here is what? The uterus, and then this is what? The vagina. This is the urinary bladder, and that is what? The urethra. The genital papillae would be down there. Okay, go back to the first slide again. Let's do them one more time. All right. So obviously, if they're dyed blue, they're veins, right? Internal jugular veins, external jugular veins, subclavian. And when they merge a little bit, right there and right there, it's kind of hard to tell, but right there and right there are the brachiocephalic veins. But from here down to the heart, it's only about that long now. For some reason, people always miss this on tests. I never figured that out. But from there to there is the what? Superior vena cava. Inferior vena cava. Larynx, trachea, right? Of course, lungs and what? Liver. All right, go to the next slide. All right, there's a heart. That's a right ventricle. So this is the pulmonary trunk. That big artery that carries blood out of the right ventricle. Well, if it's after birth, it's going to break up to the pulmonary arteries that carry to the lungs, right? Unoxygenated blood, but this is the fetus, so it doesn't quite do all that. There's your aorta coming out and it bends. This is your aortic what? Arch. And this becomes a thoracic aorta, but don't worry about that. All right, the first artery to come off the aortic arch, it goes from there to there. Brachiocephalic what? Artery. There's a common carotid, subclavian artery, right?
So
And
those
of course,
carotids are going around the trachea?
well, yeah, that's not a good one there. But that's where they come off. And then then they split, and probably one becomes internal and external.
That's the
what?
trachea in
Cross.
between them?
Yes,
Okay.
right there. But the other picture's better of the trachea.
Let me go.
All right, that's your liver.
No, that's the line.
That's your lungs. There's your liver, and there's your what? Yeah, go back to it if you want me to show you again. That's your larynx. That's your trachea right there.
But you can't see esophagus from there.
No, I got to pull it to the side. It's
Yeah.
not shown. All right. All right, go to the next one. Ah, skip that. Okay. There's your lungs, diaphragm, liver, kidneys, ureters, bladder. Most of this is the penis, right? Preputial orifice, testes, and there's testes inside the scrotum there, right? And there's your liver, diaphragm, and what? Lungs, okay? All right, this picture here, lungs, liver, spleen, stomach, pancreas, right? Pancreas, right there, pancreas.
You should
Small
be-
intestines, colon, right? Then this is the female. That's the ovaries. That's the fallopian tube. From here to here is the uterus. That's the vagina. That's your urinary bladder, and that's what? The urethra. Some other things in here. This is where the, that would be the kidney, that'd be the renal artery, the renal vein, right? Then it splits, and these would be the iliacs. And these internal iliacs come up, and they become what? The umbilical arteries. That's actually an umbilical artery.
Where's the gallbladder?
Can't see it on this picture.
It's underneath the liver.
Be underneath the liver. All right, that's it. So those 15 questions.